Hi, I'm Mike Galloway. I'm one of the cardiologists at Natividad Medical Center. I enjoy seeing patients about cardiology because I feel like my major goal is to try and make them feel reassured that we can do something for them. So many patients have risk factors for heart disease. Those include age, hypertension, diabetes, smoking, cholesterol. And we do try to aggressively treat those, but I also try to figure out who's at a different risk factor or a risk profile. Who's at high risk, who's at low risk. And as you can imagine, all patients with those same risk factors fall into different categories. The big ones, I think, are family history. If you have a family history of heart disease, we need to know about that. And when my patients come in, I ask them right away what their family has experienced, including their parents and their siblings. Also try to get a sense of where their levels are as far as blood sugar. Are they diabetic? Are they even pre-diabetic? Because that also imparts an increased risk. And if obviously they are smokers, we want to know about that because that imparts a very high risk of cardiovascular events. So when my patients come in, I'm trying to risk stratify them. And then I want to figure out, based on my history and my physical exam, what additional testing might be important. And so we want to know, do they have vascular disease already? So in some patients, if it's appropriate, we might talk to them about doing stress testing, or we might talk to them about doing more advanced imaging of their heart, of their coronary arteries, such as tests like a CT coronary calcium score, looking specifically, do they have any plaque already evident in their coronary arteries? Because that obviously means that we need to be more aggressive with treatment of the risk factors. If they have high blood pressure, for example, I want to know, has it already affected their organs and specifically their heart? We might recommend an echocardiogram to look for evidence of hypertensive heart disease, such as thickening of the heart muscle or abnormalities in the relaxation of the heart, and in advanced cases, weakening of the heart. If somebody has any symptoms that might suggest heart failure, such as new shortness of breath or new swelling, I again might look at an echocardiogram, which is an ultrasound of the heart, to get a sense of whether there has been any impact on the heart function, both squeezing and relaxing. So there are numerous tests that we may order in addition to standard EKG and checking blood pressure and cholesterol levels, so that we get a better sense of where they stand from a heart standpoint. And based on the results of these tests, it helps us to decide how aggressive to treat people. You may have two people, for example, who have the same cholesterol levels. One person has completely normal arteries, the other one has a family history, and they have advanced plaque in their arteries. Same number, but very different levels of disease. So I think that when I see a new patient, I'm not only getting a sense of where they stand from their risk factor profile, but I also want to know how that risk factor profile has affected their heart so far, because that'll tell me how aggressive to be with treatment of this patient and how much additional testing they may warrant.